Look at your hands right now. Not casually, but with intention. As if you are seeing them for the first time. Because at the tips of your fingers sit 10 small windows, quietly reflecting what is happening deep inside your body. And while most people see nails as something cosmetic, something to trim or ignore, in medicine, they are something entirely different. They are signals. Early warning systems. That often speak long before pain. Long before fatigue. Long before any symptom forces you to pay attention. Over the years, I have seen serious conditions reveal themselves in the nails, weeks, even months, before a diagnosis was made. Which raises a simple, but powerful question. When was the last time you truly looked? Not glanced, but observed. Because what you are about to learn today may reveal something your body has already been trying to tell you. Your nails are not just dead tissue. They are formed in a living structure beneath the skin, called the matrix. A highly sensitive area that responds to changes in blood flow, oxygen, nutrition, and inflammation. And what it produces becomes a visible record of your health over the past several months. Like a quiet archive written in color, shape, and texture. And once you understand how to read these signs, you begin to see your body differently. Not as something that suddenly fails, but as something that communicates, constantly, patiently, and often very subtly. A healthy nail carries a soft pink tone. A gentle warmth that comes from blood flowing smoothly beneath the surface. But when that color begins to fade, when the nail turns pale, or even takes on a washed-out white appearance, it can be an early indication that something deeper is happening. Often linked to low hemoglobin levels, meaning anemia, where the body is not carrying enough oxygen through the blood. And what makes this particularly important is that this visual change can appear long before you feel tired, long before weakness, and in some cases, when the entire nail becomes uniformly pale or milky. It may reflect early stress on the liver, where protein balance and blood flow beneath the nail begin to change. And the body quietly signals this shift through your fingertips, making the nails one of the first places where internal imbalance begins to show itself. When nails begin to turn yellow, most people assume it is simply a fungal infection. Something harmless, purely cosmetic. But especially after the age of 50, yellowing nails can carry a deeper message. Because while fungal changes are common, persistent yellow discoloration, especially when combined with thickening and slowed growth, can reflect broader issues within the body, including problems with the lymphatic system, where fluid and waste are not properly drained, or even chronic respiratory strain. And in some cases, when all nails are affected together, it can point toward a condition where circulation and tissue health are compromised. What appears on the surface as a simple color change is actually the body revealing a systemic slowdown, reminding you that even small visual changes deserve attention when they persist. A bluish or gray tint in the nails is something that should never be overlooked, because it is often a direct reflection of oxygen levels in the blood. And when oxygen delivery is reduced even slightly, the color of hemoglobin changes. And that shift becomes visible through the thin tissue beneath the nail, creating a subtle but important change in tone. This can occur in conditions affecting the lungs, the heart, or overall circulation, where the body is struggling to deliver enough oxygen to its tissues. And what makes this sign so powerful is that it is visible. It does not require equipment. It does not require testing. It is simply there, waiting to be noticed. And while it may appear mild, it represents a fundamental process that should never be ignored. One of the most important signs to understand is the appearance of a dark vertical line running from the base of the nail to the tip, because while in many cases this can be harmless, there are certain characteristics that make it more concerning. If the line becomes wider over time, if the color appears uneven, or if the pigment begins to extend beyond the nail onto the surrounding skin, then it may represent a rare but serious condition known as subungual melanoma, a form of skin cancer that develops beneath the nail. And what makes it particularly dangerous is how easily it can be dismissed in its early stages, which is why awareness is so critical, because early recognition can make a life-saving difference. If you take a moment to look at your nails from the side, you may notice something subtle in their shape. A natural, gentle curve that most healthy nails maintain. But when that shape begins to change, it can reveal important clues about your internal health. Nails that curve inward, like a small spoon, often point toward iron deficiency, where the body lacks the essential building blocks to maintain strong keratin structure. While nails that become overly rounded, bulb-like at the tips, a condition known as clubbing, are associated with deeper conditions involving the lungs or heart. These changes happen slowly, often unnoticed, but they are among the most specific signals the body can produce. The surface of the nail also tells a story, one that many people overlook, because small changes in texture can reflect events that have already occurred within the body. Vertical ridges may develop gradually with age, but deeper horizontal grooves often form after periods of stress, illness, or recovery, moments when the body temporarily slows down non-essential processes like nail growth, leaving behind a visible line as a marker of that moment. And in some cases, small pits or indentations across the surface may signal early autoimmune activity, where the immune system begins to affect the skin and nail matrix, often before any other symptoms appear, making the nails a kind of timeline, quietly recording the body's experiences. When nails become brittle, peeling, or begin to crumble, it is easy to assume the cause is external. Frequent washing, environmental exposure. But very often, the root lies within, where the body is no longer maintaining strength and flexibility. This can be linked to low thyroid function, chronic dehydration, or poor absorption of key nutrients, essential for structure and resilience. And what appears as a simple cosmetic issue becomes a reflection of deeper imbalance, reminding you that even the smallest changes deserve attention when they persist. And when you step back and look at all of this together, one idea becomes clear. Your body does not suddenly break down. It communicates. Slowly, quietly, consistently, offering signals long before problems become severe. And your nails are one of the most accessible ways to observe those signals. No equipment, no appointments, just awareness. And if you take even a few minutes each week to observe them carefully, in good light, noticing color, shape, and texture. You begin to shift from reacting late to acting early. And that simple habit can change the way you understand your health. If this opened your eyes, even slightly, share it with someone who might never think to look. Because sometimes, the smallest signs are the ones that matter most. And if you want more calm, clear, and trustworthy guidance like this, make sure to subscribe, because your body is always speaking. And together, we are learning how to listen.